Good afternoon. We will start. It's already 2 o'clock. So I'd like to welcome everybody to this pep talk today on hemorrhoids. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. The link has been placed in the chat box and also in the Viber group, as well as in the Facebook group. Another reminder, 50 OLETE certificates will entitle one to a voucher for ROJoson telemedical consultation. We are now on our 49th pep talk. So let's now have a group picture taking before we start the pep talk in 2 minutes. You show your face. Okay. Well, the others are not yet in the. Chuchi, Phoebe. Wala. Okay, 1, 2, 3. Oh, pahabol si Chuchi. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control of the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on the enthusiasm of the participants. We are now, as I said, we're now on the 49th pep talk. My pep talk today is entitled Fundamentals and Generalities of the Medical Management of Hemorrhoids. This is part of the health disorder course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities of the medical management of hemorrhoids. The contents of this pep talk on hemorrhoids will consist of the following: what are hemorrhoids, different types, causes, how common, clinical diagnosis, paraclinical diagnostic procedures, basic treatment modalities, clinical course of hemorrhoids, prevention of hemorrhoids, myth and facts on hemorrhoids. Definition of terms in the title of the pep talk and the limitation of the coverage of the talk. The word fundamentals will be used to mean the simplest and essential facts and theories which can serve as a basis or foundation and support for advanced future information. Generalities will be used to mean general statements of information, not covering specifics and details. And the phrase medical management means the diagnosis and treatment usually done by physicians. As to the first topic, what are hemorrhoids? Hemorrhoids are swollen and inflamed veins, mga ugat, around the anus, in the lower or in the lower rectum. This is the anus, the lower rectum, okay, similar to varicose veins on the legs. Okay? So these are inflamed or enlarged, swollen mga veins, okay, blood vessels, which are called veins, not the artery, just the veins. Okay, and there are usually multiple. That's why we usually call it hemorrhoids. Hemorrhoids. No? Okay. What are the different types of hemorrhoids? Two types of hemorrhoids, external and internal. External hemorrhoids, which form under the skin of the anus. Dito sa balat. No? Okay. Below the so-called dentate line. This is the demarcation. Okay. If the enlarged veins are above the dentate line, we call it internal hemorrhoids. Okay. Internal hemorrhoids. So external and internal. Okay. The boundary is the dentate line. Okay. Now, at times there could be a mixture of the two. Okay. So mixed hemorrhoids means combination of internal and external hemorrhoids. Okay. What are the causes of hemorrhoids? Hemorrhoids have a number of causes or risk factors, but often the exact cause is unknown. The exact cause is not usually known. It can develop from increased pressure in the lower rectum due to prolonged or long-standing or perennial or always straining during bowel movements. Sitting for a long period of time on the toilet can also cause hemorrhoids. Having a chronic diarrhea and constipation can also cause hemorrhoid. Being pregnant when the growing uterus presses on the veins, okay, in the pelvis. Okay. Regular, prolonged heavy lifting of objects, yung mga weightlifter, okay, and other unknown reasons that we still have to discover or to take note of. Then how common are hemorrhoids? They're very common in both men and women, to the point that sometimes we can say that human beings, because of their standing position, they usually have hemorrhoids, okay, because of the gravity. Okay. It has been projected that about half of all people will have hemorrhoids at some point in their life by age 50. Okay. So pag tumanda na at age 50, karamihan may hemorrhoids. Okay? But approximately only 5% of the population suffer. Okay? 5% of the population. Maraming may hemorrhoids, but usually konti lang nagsasuffer. Okay? 5% of the population suffer from the hemorrhoids. And women usually get hemorrhoids during pregnancy and childbirth. Okay. The pressure of carrying a baby in the belly puts extra stress on the blood vessels in the pelvic area. Okay. And then during the delivery, there are a lot of straining going on. Okay. So that will aggravate the hemorrhoids. Clinical diagnosis of hemorrhoids. So the cues, the signals, the suggestions that you may have hemorrhoids will be the following. The primary cue, the number one cue, will be something is protruding through the anus, from the anus, and coming out through the rectum. Okay. So if you feel something coming out through your rectum, your anus, you should suspect hemorrhoids already. Okay. Now, other cues will be bleeding through the anus, particularly on defecation. Magdumudugo right away after defecation. Okay. Pain in the anus. Okay. Masakit. Perianal swelling. Okay. Itchiness in the anus, especially right after may konting erosion ng hemorrhoids, and then the times if there are bleeding also, there could be itchiness, and then mucus discharge in the anus. Okay. Okay. Hemorrhoids can be symptomatic or asymptomatic. Andyan siya, wala kang nararamdaman, so asymptomatic. If it's symptomatic, you feel the pain, you feel the itchiness, okay? You feel the bleeding, okay? Types of hemorrhoids, as I mentioned, you have external, internal, and mixed internal and external, okay? Again, dentate line. So above the dentate line, if the varicose veins above the dentate line, then you call it internal. Below the dentate line, so pinakamababa sa bukana ng puwet, it's already the external, okay? So with sometimes it can be a combination of the two, external and internal hemorrhoids. How do you recognize an external hemorrhoids? An external hemorrhoids, madaling i-diagnose because you just look at the anus kasi nasa bukana lang. So you can easily recognize them, okay? So it's under the skin around the anus, okay? So this one, okay, external, and then this one. So they don't usually prolapse. Andyan na sila, hindi sila bumababa. Nakapirme na lang sila dyan, no? Pero sometimes it looks like it's prolapse, no? Prolapse means it's coming from above, but since the external hemorrhoids are located at the external opening or the bukana, so andyan na siya, no? Okay. So at times you can have thrombosis, blood clotting of the external hemorrhoids, okay? Kung may blood clots dito sa hemorrhoids mo, it could be very, very painful, okay? So usually the external hemorrhoids do not prolapse. Ito internal hemorrhoids ito galing sa taas, no? Okay. So ito may konting combination na internal and external hemorrhoids na isa tabi. External hemorrhoids, internal hemorrhoids. How do you recognize internal hemorrhoids? Unless pag naka-prolapse, baka pwede. It's easy to recognize it. But usually, you have to examine the anal canal and the rectum, not just the anus. Kasi yung internal hemorrhoids is coming from a little above, okay, above the so-called dentate line. No? Okay. So you have to do a digital examination using the rectal, a glove finger, okay, papasok sa rectum to feel for the internal hemorrhoids. And then most of the time, you have to do a visual inspection, inserting a scope called the anoscope or proctoscope to check whether it's really internal hemorrhoids or something else. Kasi not all bleeding from the anus are coming from the hemorrhoids. Baka may tumor dyan, baka may mga bukol-bukol, no? Okay. So there are several gradings of the internal hemorrhoids. Okay. So this one is based on the propensity for prolapse. Okay. So yung grade 1, walang prolapse. Malaki lang yung dilated ng vessels, prominent. Okay. Hindi pa bumababa. Grade 2, bumababa na ng konti na. Okay. Pag nagbe-bear down yung pasyente, bumababa, pero bumabalik siya. Spontaneous reduction. Okay. So that's grade 2. Grade 3, prolapse, bumababa, pero pwedeng ibalik by manual reduction. Okay? Itutulak ng kamay, ng daliri, no? Papasok. Okay? So this is grade 3. Now, once it has reached a stage in which it cannot be pushed back inside, then that's categorized as grade 4. Okay? From 1 to 4, the mildest will be grade 1. The most severe will be grade 4. So in the diagnosis of internal hemorrhoids, okay, not prolapsing as seen in stage 1 and 2, so you need an anoscope to diagnose the internal hemorrhoids. So this is an illustration of showing the anoscope. Okay, papasok doon, so makikita yung internal hemorrhoids. No? Okay, it's either grade 1 or grade 2. Okay. Or baka grade 3 kasi nakapasok lang. No? Okay. So ito yung internal hemorrhoids. So you really need to have a scope to look at the status of the hemorrhoids, whether it's internal or usually combination, or baka meron pang ibang reason for the bleeding. Now, for those internal hemorrhoids which are in stage 3 and in stage 4, okay, stage 3 means the prolapse that you have to reduce it manually, dapat itulak. Stage 4, hindi mo na pwedeng ibalik, no? Okay, so example will be this one, no? Okay, prolapse, no? Very severe. Okay. So this is a mixture of internal hemorrhoids and external, okay? But ang nagpo-prolapse, the internal hemorrhoids, okay? So if it's prolapsing, you can see them through the anus, okay? But you still have to check to take a look at the inside through the using anoscope to check the upper extent, kung nasaan sila, and also to check for other lesions and other diseases that might cause the bleeding. Severity of hemorrhoids, as I said, grade 1 to 4, the mildest, okay, to the severe form, okay, grade 4. Okay. So dito, grade 1, halos walang nakikita sa labas, okay? Then, grade 2, may nakikita sa labas, pero pumapasok pa siya, okay? This one, nakikita sa labas, okay? But dapat itulak para mawala. Okay, para maitago, no? But grade 4, palaging andyan, hindi na siya bumabalik. Okay, so this is grade 4. So another classification of severity of hemorrhoids now will be to count the number of piles or the hemorrhoids, whether 1, 2, 3, 4, okay, or even more, or using the anus, the circumference of the anus, then determining whether the hemorrhoids are occupying less than 50% or more than 50%. Okay. So kung isa lang, dalawa, you can say it's a mild hemorrhoids. Okay. Kung tatlo, apat, lima, okay, it's a more severe hemorrhoids. Okay. Or in terms of, let's say, kung more than 50% of the circumference of the anus are occupied by hemorrhoids, medyo severe na yan. Okay. So this is a evaluation method that can be used to determine whether an operation should be done already or not. Okay. So another factor that will determine the severity of the hemorrhoids will be the presence of bleeding. Okay. Not all hemorrhoids will have bleeding, but there are some hemorrhoids which will bleed. Okay, and some will bleed mildly, occasional lang, konti-konti lang. So this is the most common, okay? Then some will have moderate bleeding and recurrent, okay? And then some would have severe, na hindi pa kailangan ng blood transfusion. But in the rare case, very rare ito, you have very severe bleeding, yung tumatalsik, nag-splash, no? And then you need blood transfusion, okay? So there are different degrees of bleeding, okay? Another factor that will determine the severity of the hemorrhoids is whether thrombosis or blood clots is present or not. Okay, so the blood clots prevent the blood flow in the blood vessels. That's why masakit na masakit yon. Okay, so thrombosed external hemorrhoids versus non-thrombosed, thrombosed ones are very painful. Kung di siya thrombosed, usually hindi siya masakit. Okay, then for the internal hemorrhoids, which prolapses, you can also have a thrombosis, and it can also be painful. Paraclinical diagnostic procedures for hemorrhoids. A paraclinical diagnostic procedure is needed if one wants to check whether there is an internal hemorrhoid. May suspect tayo internal hemorrhoid, just want to check kung talagang meron, and to check for other lesion in the anus and rectum, baka may tumor, okay, that might be causing the bulge or the mass or the bleeding, okay. So the paraclinical diagnostic procedure usually done is the rectal exam, in which you insert a gloved, lubricated finger into rectum, okay, ito, to feel for the internal hemorrhoids and other lesions that might be present. So ito, by feel nito, hindi nakikita, okay? But with the use of the anoscope, makikita mo yung sa loob, okay? So you visualize the inside of the rectum through the scope. Not all bleeding per anus appearing right after a defecation, after a bowel movement, are due to hemorrhoids. Okay. There are other causes such as polyps and rectal cancer. Ang pinaka-dreaded condition is a rectal cancer. Okay. So thus, a paraclinical diagnostic procedure is needed to check if the bleeding is just caused by the hemorrhoids and not by other lesion, particularly rectal cancer. These basic treatment modalities for hemorrhoids. Okay. So they usually go away on their own, yung mga maliliit, okay? And treatment plan will depend on how severe the hemorrhoids are. Okay, sabi natin, yung mga factors that will determine the severity will be the degree of prolapse, the bleeding, and the thrombosis. Okay, so the basic treatment modalities for hemorrhoids will be surgical, non-surgical, potentially surgical. In surgical, when you categorize it as surgical, it should be outright surgical treatment, hindi na dumadaan sa mga medical treatment. Non-surgical, hindi kailangan ng operasyon. Potentially surgical, to do the surgery only when nag-progress yung hemorrhoids. Okay? So baka pwede pang gamot, no? Okay? So just wait and see until the more progression of the hemorrhoids will occur, then you might have to do a surgical treatment. Indications for outright surgical treatment, we call that hemorrhoidectomy. Ang medical term for surgery for hemorrhoids is hemorrhoidectomy. Ectomy means removal. Okay, so when you have very severe bleeding, needing blood transfusion, talagang kailangan operahan na kagad. Okay, and then you have permanently prolapsing internal hemorrhoids like this one. Hindi mo na ibabalik na yan, eh, no? And circumferential, no? Okay, so these are two indications for outright surgery as the treatment of choice. Now, for the non-thrombosed external hemorrhoids with no pain, as I said, dalawang klaseng, there are external hemorrhoids which are thrombosed, which are not thrombosed. Okay, so for those which are not thrombosed and no pain, so the options will be non-surgical treatment. Hindi kailangan operahan kagad, watchful waiting, dietary and lifestyle modification, and medications if needed. Okay. Surgical management is only done if the patient is severely bothered and distressed. There are some patients, kahit ng ganong kaliit lang, bothered na bothered, kahit na anong sabihin mo. No? Okay. So ito, actually, hindi mo masakit ito, kaya lang, palaging nahihipo, no? Nandyan palagi sa puwet, no? Okay, ganon. So naistorbo, okay? There is such a condition like so-called hypertrophic papillae, which are not really hemorrhoids, no? So sometimes you have this one. This is not the hemorrhoids, which do not really need surgery, but kumisan, because naistorbo yung pasyente, it has to be removed, okay? Now, for the thrombosed external hemorrhoids, as I said, dalawang klaseng external hemorrhoids, thrombosed or non-thrombosed, and then merong pain. Usually, pag may thrombosis siya, may pain na siya. No? Okay. Ito yung example na non-thrombosed external hemorrhoids. Okay. Again, pwede pa rin usually surgical management. No? Usually, kasi masakit na eh. No? But at times, you can do watchful waiting. Kung kaya pa ng pasyente, dietary and lifestyle modification, and warm sitz bath and medications. Okay. Now, for the internal hemorrhoids, grade 3 ito, grade 3 prolapsing but has to manually reduce. Okay, grade 3. Okay. So the management is surgical management usually. Okay, pero kung ayaw ng pasyente, pwede pang i-tolerate, no? If the patient can tolerate discomfort, then you can use the non-surgical management. Now, for grade 2, internal hemorrhoids, yung nagpo-prolapse but spontaneously reducing, majority will choose this option, non-surgical management. Ngayon, kung the patient is severely bothered and distressed by that paulit-ulit lumalabas, then surgical treatment has to be done. No? Now, for grade 1, ito yung hindi kailangan operahan. Okay? Non-surgical kasi maliit lang siya. No? So you just do watchful waiting and dietary and lifestyle modification. Try to have some management program that will ensure that it will not progress to grade 2, grade 3, grade 4. Okay? Usually avoiding straining, avoiding constipation. Ito nga, dietary and lifestyle modifications. Okay? So for grade 1, watchful waiting. Okay. Okay. Hemorrhoids usually go away on their own, as I mentioned. Simple dietary and lifestyle changes can often relieve mild hemorrhoidal symptoms within 2 to 7 days. Usually nawawala within 1 week. Okay. Pain and bleeding usually spontaneously disappear after a few days. Yung mga mild bleeding lang, usually nawawala siya. So don't be alarmed. Okay. Kasi if you get alarmed and then you get to the emergency room, and then the doctors do not really warn you that it can disappear, they will just operate on you. Okay. So if symptoms cannot be tolerated, then take the additional measures like medications. Okay. So when I say symptoms cannot be tolerated by after doing simple dietary and lifestyle changes, then you have to take medications. What are the problems with the hemorrhoids? Usually discomfort, okay? Particularly yung mga prolapsing hemorrhoids, which remain outside on the anus, grade 2 to grade 3. Grade 2, spontaneously bumabalik pero lumalabas. Okay? Grade 3, ipapasok mo pa. Grade 4, andyan palagi na sa labas. Okay? And then the external hemorrhoids can also cause some discomfort, particularly yung mga pasyente na very yung threshold nila mababa. Kung nakakapa nila, something lumalawit, na-istorbo na sila. Okay? So the other problems with hemorrhoids will be pain and itchiness and then bleeding. Okay? For those in which surgery is not indicated yet, what are the non-surgical treatment that can be done? Okay, yan ang tanong. Okay. So pain control, okay, you can use analgesics, yung mga painkiller, okay, anti-inflammatory oral medications, okay. And then topical, this is tablet, no? And then topical suppository medications with steroids and analgesics, and then venoprotective medications, because as we said, the varicose veins are problems of veins, mga veins, ugat, no? So there are some medicines that can protect the veins, okay, can relieve the problems of the venous problem. And then warm sitz bath, uupo ka lang sa maligamgam ng tubig, no? It will provide some relief, okay. So the other type of non-surgical management of hemorrhoids would be dietary changes, no? Eat high fiber diet, fiber supplement, okay. This is to avoid constipation and straining, and then also use of laxatives and stool softeners kung di kakayanin itong dalawa. Okay. Then after that, when you have these measures, you try these measures, you just wait and see. Okay. Kadalasan, yung grade 1 and grade 2, okay, nawawala naman. Okay, nare-relieve, no? Okay. And then also the bleeding, the mild bleeding will also disappear. So the examples of analgesics and anti-inflammatory oral medications will be paracetamol. Kaya yung paracetamol kung mild pain lang. Kung hindi kakayanin paracetamol, then you take the NSAID or non-steroidal anti-inflammatory agent. Okay. And tramal, ito yung pinakamalakas. Okay. O malakas na. Okay. Topical medications, you can have cream, ointment, suppository. Examples will be preparation H, FAC2, Silocaine. This is the local anesthetics. Okay. Then the samples of venoprotective medication, you have the Daplon and then the Doxum or calcium dobesilate. Okay. Surgical treatment, usually there are 4 types. Sclerotherapy, you inject, infrared coagulation, rubber band ligation, and then hemorrhoidectomy, yung tinatanggal hemorrhoids through an operation, okay, using either suturing or staple. So this is a illustration of sclerosing agent being injected into the steroids. Inject yung gamot dito para para mag-collapse, mag-necrose, para mag-sclerose, para bumuo, okay, maging fibrotic. Infrared coagulator, okay, this is the machine being used, okay. Not very commonly present in our country, okay, pero may mga ibang gumagamit. Okay. Rubber banding. So rubber banding is that you use this ito yung instrument, you insert it, pasok mo sa internal hemorrhoids, and then after napwesto na, you just fire this gun, and then the rubber band will be at the neck of the hemorrhoids. Okay. So habang tumatagal, magne-necrose ito. Okay? Mapuputol ito, kaya matitira ito. Okay? So it's placed around the base of a symptomatic hemorrhoid to stop the blood flow, which then dries up and falls off on its own a week or two, usually during a bowel movement. Okay? Hemorrhoidectomy, a formal operation, will be ito. Ikakat mo ito, yung hemorrhoid, itatahiri ito. Okay. Yung blood supply nito, yung pinaka-root, no? Okay. So another example, ito. Ito yung hemorrhoids, you put a suture there, then remove it, and then suture it. No? Okay. Some would leave it open para hindi mag-infect. Okay. So there are various options for the treatment of the hemorrhoids. So you just have to choose one which is the best for you in terms of benefit, risk, cost, availability. Okay, in terms of availability, the most available is the open hemorrhoids, hemorrhoidectomy. Okay, yung rubber band meron, pero hindi lahat meron, na? Okay. Sclerotherapy meron din, pero only a few colorectal surgeons are using that. Okay. Now, you also compare the cost, how much it will cost, okay? And then, of course, the risk, and then the benefit. Kung let's say sclerotherapy and infrared, probably about 75 success lang yon. Then open hemorrhoidectomy, about 95-98% successful. Okay. Clinical course of hemorrhoids. Okay, as I said, usually go away. The treatment plan depends on how severe the symptoms are. Okay. Simple dietary and lifestyle changes can often relieve mild hemorrhoidal symptoms within 2 to 7 days. So once with hemorrhoids, exert more efforts to avoid constipation through dietary changes and lifestyle complications. So at the moment, this is the most practical suggestion. Once you have hemorrhoids, avoid mo na yung constipation. Okay? So these are the essential strategies to avoid progression. Okay, so ayaw mo na mag-progress to grade 2, grade 3, grade 4, and then bleeding, and then thrombosis. And then you also you want to avoid operations, of course. Okay. Prevention of hemorrhoids. Okay. Avoid constipation. Avoid too much straining, okay, when pooing. Okay. Eat foods high in fiber with adequate fluid intake to make the stools softer and easier to pass through the anus. Okay. Then, if you cannot use the natural food, high fiber diet, then you can use fiber supplement. Okay. If you cannot get enough fiber from the foods. Okay. Then exercise. Physical activity like walking half-hour a day keeps your blood and your bowels moving. Then don't wait to go. Pag dudumi ka na, dumi ka na. Okay? Wag mong pigilin and then wait for another time. Okay? So then the other one is don't strain during a bowel movement or sit on the toilet for a long period. This puts more pressure on your vein. Kung matagal ayaw pa lumabas, you just leave the toilet and then just wait for a few minutes outside. Now, okay? Do something else. Then if you feel the urge, then go right away to the bathroom. Myth and facts on hemorrhoids. Yung mga iba sinasabi, hemorrhoids can only develop, does not develop in the young. Okay, but the fact is, people can develop hemorrhoids at any age. Okay, although there are the older people are at risk. Okay, because as people gets older, the connective tissue between the anus and the rectum weakens because of the aging process, making them more susceptible to hemorrhoids. Okay, and more than 75% of people will experience hemorrhoids in at least once in their lifetime. Okay, so practically, you can say that practically everybody is at risk of developing hemorrhoids. Number one, because we have to poo every time, every day. Okay, and then the type of foods that we eat, kuminsan, they cause constipation. Okay, and then yung standing position din ng tao because of the gravity. Okay. The other myth is that spicy foods cause hemorrhoids. Yan ang maraming nagsasabi, ay, kung kumain ka ng maanghang, magkakos ng hemorrhoids. No, it's a false myth. It's a false, okay? It doesn't hold water. It's not true, okay? What you eat does not affect your hemorrhoids, okay? The fact is, constipation is one of the biggest risk factors for developing hemorrhoids. Okay, so you have to eat a high fiber diet and stay well dehydrated. Okay, not only the high fiber diet, pero samahan mo yung maraming tubig. Okay, it can soften your stools and prevent constipation and straining. So the American Society of Colon and Rectal Surgeons recommend 20 to 35 grams of fiber daily. I don't know what's the actual equivalent. Basta kumain ka ng high fiber, okay na. So if you're not getting enough dietary fiber, fiber supplements may be beneficial. Okay. It's unusual to need surgery for hemorrhoids because symptoms generally clear up on their own and with conservative treatment. Ito yung fact. Okay? So huwag kayo matakot once you have hemorrhoids, ay, kailangan operahan nito. Okay. So just think that depende sa stage, depende sa severity. No? Okay, but majority will not need operation. So the cornerstone of hemorrhoidal treatment will be dietary changes and lifestyle modifications. So avoid progression if you have it already, okay, and then avoid constipation. Actually, statistics will show that only 10% of people with hemorrhoids require surgery. Okay. Pero pag hindi nyo alam, ito, once you have hemorrhoids and then you meet a lot of surgeons who will just ride on your anxiety. Oh, may konting bleeding, tanggalin na natin. Okay? May konting hindi mo siya mawawala, no? Tanggalin na lang natin. So there's such thing as asymptomatic hemorrhoids. You don't have to have it removed right away. No? So the other last item here, hemorrhoids are not cancer. Hindi siya cancer, ha? Okay. A lot of people still think that baka cancer na yan, baka ano. Okay? They do not lead to cancer also. Okay, hemorrhoids are hemorrhoids. Cancer is a different story. Okay, so you can have a mass, you can have a mass there in the anus, but this is not hemorrhoids, but it's cancer. It can cause also bleeding. It can also cause pain. Okay, so that's why it's important to have the yung scope inserted to check whether hemorrhoids ba ang talagang meron andyan or cancer. Okay. So if you have hemorrhoids also, just make sure that there is no associated presence of the cancer. Kung minsan pwede sila magsabay. Okay. So summary and takeaway. So I have discussed the following topics: hemorrhoids, what are the different types, causes, how common, clinical diagnosis, paraclinical diagnostic procedures, basic treatment modalities, clinical course, prevention, and myth and facts on hemorrhoids. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on fundamentals and generalities in the medical management of hemorrhoids. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, at kapangyarihan to gain greater control over decisions in the medical management of hemorrhoids. So with that, I end my lecture, my pep talk. I hope I have empowered you to have a better understanding of the fundamentals and generalities of the medical management of hemorrhoids. So before we go to the question and answer session, that's a reminder, take the OLETE for Mastery of Learning and get a certificate. 50 OLETE certificates will entitle one to a voucher for a ROJoson telemedical consultation. So let's now have a group picture taking before we go to the question and answer sessions. Okay. Ready? Everybody ready? Omar, last call. 1, 2, 1, 2, 1, 2. Oh, may pahabol. 1, 2, 3. Okay. So the floor is now open for questions and comments, sharing of experience. Sinong may hemorrhoids na? Sinong na-operahan na? Chuchi, na-operahan ka? Are you questions? You have a questions?
I just want to comment. My hemorrhoids, I have hemorrhoids up to now, but luckily it's mild. But I've had it since I gave birth to my first child. I have 4 children, and I'm lucky that my brother,
Si Bobby.
you are Bobby, you are the mentor of my brother. He said the same things. You know, he gave me that lecture so many years ago.
Yeah.
And so I was able to manage my hemorrhoids through diet. And so I take salads every day and all fiber. Ganyan. So I'm very, very regular with my bowel movement. And I'm so happy that that my brother, I'm just lucky that my brother gave me that information early enough. Okay, so, and thank you again for giving us this information again, no? Because I'm sure many of them, or many of us, the older ones, are also experiencing the same thing.
Yeah.
Yun lang po.
Yeah.
Thank you.
Thank you for sharing. Okay. Anong salad ang kinakain mo? Green salad?
Green salad.
Green salad.
And I mix it with nuts, and I just love it.
Yeah, ako rin, yan ang experience ko. I think the best food will be the green salad.
Yes, raw. And I never miss a day without every time I have salad, every 5 o'clock in the morning, I do my bowel movement. So it's as regular as breathing.
Yeah, good. Very good. Very good. Okay. So ako rin may hemorrhoids, but I usually try to avoid it from it's getting bigger and bigger. Yan lang naman. Alay ko lahat tayo meron to a certain degree. Na? Okay. So what I want to emphasize is that you have to know that it's you can prevent its progression, no? And then number 2, huwag kayo kakagat sa mga surgeon who will tell you you need to be operated on because hindi siya mawawala at dumudugo, gano'n na. Okay. So if you're not aware of those natural course that it will go away, I mean the symptoms will go away, kakagat lang kayo, na. Okay. Okay.
And we should not be embarrassed about it because it's something natural, something that happens.
Yeah.
Diba?
Yeah. Okay. So do not be embarrassed, tama ka, no? Kasi a lot of lay people, Filipina, no, no, ay nakakahiya naman, nakakahiya. So minsan when they consult me, ay nakakahiya na ipakita sa akin yung hemorrhoids. Okay. Any other comments? Thank you, Chuchi, for the
There is a question from Jocelyn P. Is it hereditary?
It may, but only a few. It may. Just like any medical conditions in life, no, there is a certain percentage that it's hereditary, no, because it runs in the family. But 90% of the cases, it's not. More than 90%. No, it's due to the lifestyle. No, lifestyle, of course, yung mga babae, di ba? Because pag cesarean kayo, baka hindi gaano, no? Walang masyadong pressure. Pero once you deliver through the normal route, no, you have for 9 months or 6 months at least, no, andyan yung pressure, di ba? On the pelvis, di ba? Okay. And then iiri pa kayo during delivery, di ba? Okay. Kaya lalabas, somehow lalabas yung mga hemorrhoids inyo, but after delivery, you can manage to control it, just like what Chuchi mentioned. No? Okay. Any other questions?
Yeah, I also have hemorrhoid. I got it from my second pregnancy. My question is there a hemorrhoid cancer? Can it lead to cancers?
Wala. I just mentioned the fact, the myth and fact, di ba? Hemorrhoids are not cancer. They will not lead to cancer. Okay? So I think the reason why people were led, some people, or it becomes a myth probably, no? Because baka nag-coexist kasi yung cancer saka yung hemorrhoid in some patients, no? Kaya sinabi nila yung hemorrhoids was the one causing the cancer. No? Okay. As I said, it's possible that you can have simultaneous presence of the hemorrhoids and the cancer. Okay? But yung cancer itself does not, the hemorrhoids does not lead to the cancer. Okay? Baka yung cancer pa, okay, na because pag nagbara doon, yung hemorrhoids, baka lalaki siya, di ba? Okay? But not the other way around. No? So hemorrhoids does not lead to cancer. It's not cancer.
Okay. How do you know that the bleeding comes from your hemorrhoid or it comes from your colon?
Yun nga, scope. Dapat may scope. No? Okay. Pag in-scope, walang nakitang bukol sa itaas, most likely hemorrhoids niyo. Galing sa hemorrhoids. Okay. Kaya yung mga na-operan sa hemorrhoids, usually one of the routine that things that being done by the surgeon is scope muna, di ba? Anoscope, no? Ngayon kasi napapamahal ngayon eh. So they use the colonoscope. Pero pwede na yung maikli lang, pwede na yon. Okay. Proctoscope or anoscope, pwede na. Kasi mas mura yon, no? Okay.
Okay, there's a follow-up question from Jocelyn T. Is the scope done by a surgeon?
Pwedeng surgeon, pwedeng gastro. Pwedeng gastro, pwedeng surgeon. Pero kung hemorrhoids na ready for surgery, the surgeon will do it na. Will do it, the scope. No? Okay. Any other questions?
Thank you.
Any more questions?
Nothing at the chat box.
Still have 3 minutes. Okay. Sandali
Nagkaka-cause din ba yan ng gases or digestive problem?
Ano?
Nagiging cause din ba ng yung gas at saka digestive problem, nakaka-cause ba yung hemorrhoid?
No. Gas hindi. Digestive problem, yung pag constipated ka. No? Pag palagi ka constipated, that will promote the development of hemorrhoids. No? Okay, pero kung gas, hindi. No? Okay? Okay. So, since we still have 2 minutes, okay, ito yung hindi ko pa natatanggal. Ito kasi nasa ulit ito, ha? Just for ano. Ano ito? What's this one? External, internal?
Internal.
Internal.
Ito?
External.
External.
Ito?
Mixed.
Mix.
Mix.
Okay, good. Ito, ano ito?
External.
External.
External. Hindi siya thrombose, ha? Medyo mapula-pula pa, no? This one.
Mix.
Ito. Ito yung puwet.
External.
External. External.
External pa rin, no? Okay. Ito.
Internal.
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 Prolapse ito, ha? Ito internal nagpa-prolapse. Okay. Usually yung external may balat eh, di ba? Okay. Yung internal, yung mucosa, yung pink yung lumalabas, yung bumababa. Okay. And then ito, very severe na ito, no? Grade 4.
Internal.
Internal, external.
Internal.
Combination. Ito yung
Mix.
nakita nyo, maga, no? External ito, and then ito yung internal.
Mm.
So, which one is the mildest?
A.
A.
Okay. Which one has a can be manually reduced?
C.
C.
Okay. Yung hindi na ma-reduce, 4 na yon, no?
C.
Yes.
Okay. Good. Very good. Okay. So, ito, in terms of severity, alam naman nyo, this is the mild, moderate, severe. Okay?
Here.
Okay. Kung isa-isa lang ganito, kaya naka-istorbo, to tell you a story, several years ago, 20 years ago, hindi ako believe doon sa classic kasi ang ginagawa ng mga colorectal surgeons all over the world, they just use yung prolapse lang eh. Hindi kasama yung number, no? So I was looking for a way to determine whether the patient needs an operation or not. So ang ginawa ko na lang, I just classified it as mild, moderate, severe, no? Pero yung mga expert in the field do not talk about that. They talk about the grading, no? Pag grading lang ang ginagamit lang indications for surgery. So when I was preparing this lecture, no, I was happy to see, kasi I have to input my experience. So I was looking for an author that will tell me that this one should be considered. No? So they came out with this one. Kung isa lang, no? Okay. So mild lang yan. No? So you don't need to, kahit na nagpo-prolapse siya, you don't need to have it removed. Just do dietary. No? Pero kung doon sa old na classification, usually they suggest surgery already. No? Okay. Ito, more than medyo severe na ito, moderate, baka pwede pang subukan mo na ng medical treatment na baka bumalik pa ito ng konti. At ito definitely kailangan operahan na. So ito take note of this. Ito yung pinaka-dreaded possibility when you have bleeding. You have to check whether you have anal cancer or rectal cancer. Okay. Okay, so that's a review. So if there are no more questions, we call it.
Sir, meron pa.
Meron pa? Okay.
If Rowan, am I reading it correct, Ma'am Jocelyn? If Rowan Tainal cream is not working,
Yes.
is there a more effective cream to use?
Rowentanal. I'm not familiar with that Rowentanal. Anong generic name yan? Steroids?
Ang liit, hindi ko mabasa.
Oh,
Zinc oxide, calcium carbonate, bismuth subgalate, menthol,
okay.
anti-hemorrhoidal.
Okay. Okay. One, I have to tell you, there are a lot of medications, topical, cream, ointment, and sometimes tablet, no? But mostly topical, no? That you will see advertised, okay? Even in the internet, in the Facebook, you can see a lot of advertisement, yung mga made in China, ganun, di ba? They're going to sell, no? Okay. So, but basically, yung yung mga old preparation, no? It's as good. It's as good. Basta importante, i-modify mo lang yung dietary mo, yung habit mo, saka yung lifestyle mo. Okay? Okay. So, pwede na yun. No? So, huwag kayo kakagat dun sa mga bagong gamot. Ay, very effective ito. No? Okay. Minsan, mas mahal pa nga. No? Okay. So, there are a lot of the old medications which are also as effective. Kasi ang gagawin lang naman mga cream na yan is just relief lang naman yan eh. Hindi siya nagpapawala. No? Okay. Mawawala ng konting sakit, mawawala ng pamamaga. No? Okay. But once you don't control the progression of the hemorrhoids, andyan pa rin. Diba?
Thank you, Doc.
Okay. Any more? Wala na? Okay, kung wala na, so this is our 49. Mag-50 na tayo. So any suggestions? Tuloy pa natin?
Yes.
Yes. Po. Yes. Po.
Okay pa sa inyo?
Yes.
Yes.
Okay po.
Okay. So the next topic for the 50th lecture will be hernia. Hernia. Okay. Hernia ngayon. No? And then, after that, mag-iisip ako ng mga bagong topics. If you have any suggestions, just tell me. No? Okay. I-PM mo lang sa akin kung anong gusto niyong topics. No? Para I can prepare kahit na 2 weeks in advance. No? Okay. Okay. Christine, meron kang suggestion?
Nag-iisip pa, Doc.
Okay. So, okay. So, itutuloy pa natin, ha? So, then we'll look for topics. Okay, if there are no more questions, let's call it a day. We'll see each other next week. Abdominal hernias this time. Abdominal hernias. Okay?
Okay. Thank you po.
Bye-bye.
Doc.
Thank you, Doc.
Thank you.
Thank you.
Thank you po, Doktor.
Bye-bye.
Bye-bye po.
Bye.